If you are a federal retiree with access to federal employee health benefits, should you still enroll in Medicare? And if so, should you enroll in Medicare Parts A or B or both? Hi there, if we haven't met yet, I'm Danielle Roberts from Boomer Benefits, where every month we get questions like these from federal retirees. In this video, we'll discuss the options you have when you're eligible for both federal employee health benefits and Medicare. Be sure to hit the subscribe button if you find the video helpful, and stay tuned for some additional resources that I'm going to give you later in the video. Throughout this video, you'll hear me refer to federal employee health benefits as FEHB. Typically, people with FEHB don't need our help here at Boomer Benefits because their FEHB already provides the coverage that someone else might need to get from, say, a Medigap plan and a Part D drug plan. However, in recent years, due to the expense of FEHB, we've been getting more and more inquiries about whether people should suspend their FEHB and enroll in original Medicare with a Medigap or Medicare Advantage plan instead. You certainly have those options, as well as a couple of others. If you're eligible for FEHB, here are some ways in which you can structure your benefits once you turn 65 and are eligible for Medicare. Option 1. Keep your FEHB as your primary coverage and enroll in only Medicare Part A as secondary. Most people qualify for premium-free Part A because either they or their spouse have worked during their lifetime and had taxes taken out that have prepaid Part A. This means it costs you nothing to add Part A, and it may help you if you have any inpatient hospital stays. So you could keep your FEHB as primary and enroll in Part A as secondary. If you choose this option, you'll save the money that you would have spent on Part B premiums, but you'll pay your own copays for medical services out of pocket as outlined in the FEHB Summary of Benefits. This may include doctor copays, x-rays, diagnostic scans, surgeries, urgent care, ambulance, and so on. So you'll want to weigh the cost of paying monthly Part B premiums against the cost of paying your own copays out of pocket. Another downside is that if you don't enroll in Medicare Part B when you're first eligible and later you want it, you may be subject to a late penalty of 10% per year for every year that you could have enrolled but waited. Option 2. You can enroll in both Medicare Parts A and B, making Medicare your primary coverage, but keep FEHB as your secondary coverage. In this scenario, you're paying for Part B and for FEHB, but the advantages are that FEHB will cover the 20% coinsurance that Part B doesn't, as well as your Medicare deductibles and copays, which will ultimately leave you with very little out of pocket. You can see any provider in the nation that takes Medicare, and Part B will also pick up some things that you may not have coverage for under FEHB, like durable medical equipment. You would not need Part D since FEHB plan already includes drug coverage. This option provides fuller coverage than the first option, but you're paying for both FEHB and Part B, so again, you'll want to run the numbers and carefully consider if it's worth it to have both. Option 3. You can enroll in Medicare Parts A and B as your primary coverage and suspend FEHB. If you went this route, you would be likely to enroll in a Medigap plan or an Advantage plan to go along with your Medicare so that you have affordable but also comprehensive coverage. We sometimes see people do this if they determine that enrolling in this coverage would be less expensive for them than keeping FEHB active. It's up to you to calculate the cost of each one and decide what's ultimately right for you. You can familiarize yourself with the differences between Medicare supplements and Advantage plans by grabbing our free guide that compares these two options. I'll post the link where you can get the free guide in the description area below the video here. Now, if you need help with calculating what this third option would cost you, don't hesitate to reach out to us here at Boomer Benefits for help with that. We'd be glad to help you determine which route makes the most sense for you. Please be aware as well that the information in this video is general. Ultimately, you are responsible for researching your own options with FEHB. So with that said, I'd like to point you to several government websites that offer great information for federal retirees. You can find these links in the description below the video. Thanks for watching, and we'll see you in the next video.